Conversations for Health, dedicated to engaging discussions with industry experts, exploring evidence-based cutting-edge research and practical tips. Our mission is to empower you with knowledge, debunk myths, and provide you with clinical insights. This podcast is provided as an educational resource for healthcare practitioners only. This podcast represents the views and opinions of the host and their guests and does not represent the views or opinions of Designs for Health, Inc. This podcast does not constitute medical advice. The statements contained in this podcast have not been evaluated by the Food and Drug Administration. Any products mentioned are not intended to diagnose, treat, cure, or prevent any disease. Now, let's embark on a journey towards optimal well-being, one conversation at a time. Here's your host, Evelyne Lambrecht.
Welcome to Conversations for Health. I'm Evelyne Lambrecht, and today I'm joined by Dr. Adam Silberman, naturopathic doctor and expert in anti-aging and regenerative medicine. Welcome to the show, Adam.
Yeah, stoked to be here, Evelyn. It's a long time coming. We've been friends for, I was thinking about it. It's been 13 years.
That's amazing. Yeah, it's actually funny. I think you were the president of one of the student clubs at Bastyr. Is that right?
I helped to start a number of the clubs at Bastyr. I wasn't ever president, but definitely involved.
Okay. Well, I remember reading something about you and I thought, okay, this is someone I should know. So I reached out to you and we had fish tacos, and then we've been friends and colleagues ever since.
It's been awesome to follow your career and, have you in every practice location that I've been involved in, as well as like having you involved in business conversations has also been extremely valuable. The insight that you just offer, both clinically to providers, but also from a sort of pragmatic business standpoint is, I think, pretty unique for someone in your position to do. And we all really appreciate it. At least I do.
Wow. Well, thank you so much, Adam. That means a lot to me coming from you, especially someone who also has an MBA. So thank you.
It's got to work for you to work. It's all got to work,
So my first question for you is, what is lighting you up this week?
My kids, 100%. I've been taking them to school early. We've been playing soccer in the mornings. So that 7:45, 8 a.m. early morning, temperature here in San Diego is just perfect right now. And we get after it. My kids are 7 and 9, and we've got this little 30-minute soccer game going almost every morning before school. I love dropping my kids off sweaty, and it just puts me in a good place in the morning
I love that.
To start with clinical.
Yeah. And how great. Everybody gets physical activity, morning sun, get it all out of the system. That's awesome. All the naturopathic things. Dr. Silberman brings over a decade of training and clinical experience to his patients and their families, specializing in the use of advanced lab work, diagnostic analysis, bioidentical hormone replacement therapy, anti-aging peptide therapy, natural medicine, and ultrasound-guided joint injections to address disease and optimize health span. He earned his bachelor's in psychology from UCLA, his doctorate in naturopathic medicine from Bastyr University, and an MBA from Murdoch University in Perth, Australia. So, Adam, I'm curious, what made you want to become a doctor and pursue naturopathic medicine specifically?
There's a rose and a thorn in this story, for sure. We could start with the rose. The rose is that my wife actually introduced me to naturopathic medicine. Her name is Serena. She also sees clients in our concierge practice. And I met her in Perth, Australia. She was a practicing naturopath at the time. And I really had no exposure to it. Her lifestyle, right, as any naturopathic doctor is, right? We live the medicine first and foremost. And so being her boyfriend and then living together, I basically received a crash course in everything from making, herbal teas and tinctures, poultices, to nutrition, lifestyle, movement, and even some of the more, hot cold therapies, contrast hydro, the whole deal. So it was an experiential learning opportunity from the beginning. And, I was very performance oriented at the time. I was surfing pretty aggressive waves in Australia, and I was also playing tennis out there at a competitive level. And so having that type of support really elevated my performance, and I noticed that in my 20s. So that was the rose. And while I was out there, my dad passed away at 52 years old. It was tragic. It was complications of obesity. And since this is a medical audience, right, we think he had, an embolism and passed away, very rapidly. But, at 24 years old, I had come back to San Diego to see my dad and found him almost 300 pounds, bloodshot eyes, so happy to see me, but obviously unwell. And my dad was just a bundle of joy. The guy was a model of how to live in a show up, tell the truth, be kind, relationships matter most way. I mean, that was his litmus test for everything. Everyone loved my dad. And he saw a lot of doctors, and all of his doctors told him he was well. When I came home, I was shocked. You know how it is. Like when you don't see someone every day, when you see them every 3 or 4 months, it's easy to notice changes. And I told him, I was like, Dad, I'm really concerned about your health. I don't want my next trip back to be for your funeral.
Wow.
And it was. I'm an only child. It was for his funeral, and I delivered his eulogy at 24 years old, and it completely changed my life. At that moment, I was like, okay, I've found my purpose and my passion, which is to provide a better way for people in their health journey for themselves and their family, so that they never have to unnecessarily go through a experience like that. Because my children are 9 years old. They don't. This thing that impacted me is having a ripple effect in my entire life, and it does so in every family. My dad's state of affairs was completely reversible. Could have been completely managed. I mean, this is a guy who ran, I think, at least 14 marathons. He was an extremely fit person and had a transition in his life, and his health slipped, and none of his doctors talked to him about it. His cardiologist, his primary care physician, even his alternative medicine providers, his acupuncturist, his therapist, nobody was having the hard conversations with him. And, I'm lucky that I had a really great relationship with him. We talked all the time. We had a great conversation a week before he passed away, but this definitely didn't need to be the case. Like right now, I'm looking after his dad. His dad is 96 years old, my grandpa.
Wow.
Living here in San Diego, still able to walk, still able to see my grandkids. He comes over on Wednesdays and we all play music together.
That's amazing.
Grandpa Dick. So that was just a huge wake-up call for me. It never gets easier to tell the story because it just breaks my heart. And it is a driving factor in every decision I make as a clinician, in terms of working directly with clients, and also any consulting or business relationship I get into. The outcome has to be kind of associated with, are we putting in place tools and tactics and strategies for people to engage in what we do so that that type of thing doesn't happen unnecessarily ever again.
Yeah. Wow, that's beautiful. Thank you so much for sharing that. So I want to hear a little bit more about your practice today, what that looks like. So tell me about your typical patient. And I also know, since we have known each other since you graduated from school, you've worked at different practices. You've worked in primary care, more of the regenerative medicine side. Who's your patient now? Who do you like working with?
My patient now they're basically three types of patients that I'm seeing primarily. As any provider knows, when we see all sorts of people, because we get referred friends, we get referred colleagues, and they have different conditions. But I'm seeing primarily men who are in their 30s and above that are interested in cardiovascular disease prevention, cognitive decline prevention, and performance optimization. So they are interested in getting advanced blood chemistries done, functional medicine testing when indicated, advanced imaging and screenings, and then having programming put in place that includes nutrition, movement, right, mindfulness, purpose, supplementation, drug therapies, compounded therapies, and regen, as well as opportunities for international travel to do procedures that may not be available in the United States. So those typically are high achieving entrepreneurial individuals. Many of them own their own businesses or are part of executive teams for large companies. That's like a big percentage of my patient population now. Most of the time we're seeing their wives as well, or partners. And because I have my wife in the practice, we make a really good mix of being able to provide medical interventions in a similar manner to the men that we work with. And we have this opportunity for the the women in our practice to connect in, right, with another woman to have that relationship, right, that is unique female to female, which I, as I go, deeper and deeper into practice, I think that it is valuable to have that as well. I think that it can live together. So, we offer, right, concierge annual packages for individuals. So a man or on themselves, or a female on themselves, but we offer a discounted rate if we work with a family. And then we can add on either like parents or siblings at preferred rates, because, to my point, right, like I want to work with the whole fam, because of my own experience with my dad. And I know if I can keep, Nana and Papa around a lot longer, getting up and down from the ground and being more engaging, that has an exponential impact on my clients as well. So we do have families that we see that are like 3-generational, where we see grandparents, parents, and then grandchildren as well. And that's just awesome. So yeah, does that kind of answer your question?
Yes. Well, so you work with the CEO types, executive types, but you also see a lot of athletes, correct, in your practice?
Yeah, we do. And we glean from each area of our specialties to improve how we work with the other cohorts. So yeah, we have a track where we work with high school, collegiate, semi-pro, and professional athletes. Obviously, the biggest difference in those is classification and what types of drug therapies or interventions we can use. However, yeah, we use advanced biometric tracking. We do pretty high level testing, and we integrate in with usually a full care team in and around these athletes. Like right now we have, we just had a couple athletes in the Stanley Cup. We have, we see Major League Baseball athletes when they come off season here to San Diego to rest, right, and recover. We do a lot of testing on them at that point in time, and dial them in. And then they have us on access during season to support. Really, it's a lot of honestly, it's a lot of recovery programming, a lot of support in that piece. That's kind of where I think the real benefit of what we do can shine. And then when they retire, we then have like this transition sort of bridge that we do with them, where we do a full assessment of kind of where they're at physiologically, and then we can transition them into a life after athletics that still feels fulfilling and gratifying, right? So they don't kind of slide. We also have, as you know, Evelyne, we work with Force Dagger, which is a nonprofit that helps support special operations forces to see naturopathic and functional medicine doctors. So I'm one of one on the West Coast that works with these docs. That works with these individuals, whether they're in active duty, and we also get referrals from the SEALs Futures Foundation and other nonprofits that work with special forces. So that's been a part of my practice since 2017, and it's a really great group to be involved in. We have like kind of I call it a service arm because we work with local fire departments. So we work with Rancho Santa Fe Fire, with Vista Fire, and LA County Fire. Some people up in Northern California, and we create protocols and programming for those guys to help mitigate the risks associated with their profession.
That's so important.
They're a unique cohort.
Yeah.
So we obviously do that at a very discounted rate for them. And we also, I give a good amount of time to supporting them in lobbying for different types of testing and treatment options from the cities that they serve. So, that's a really fun thing to be a part of and extremely rewarding. And, you kind of laugh every time like a dude comes on the telemedicine, with like a big old mustache. You're like, oh, right, here we go. Like, this is fun.
I want to go back to something you said about the athletes and working on their recovery during the off season. And I'm curious, how do you work with them? Like, what trends do you notice that are common among athletes in different sports? And what do you do for the recovery aspect? And does that also kind of translate to the work that you do with, quote unquote, like the regular population, or is that totally different?
Yeah, it's connected. The biggest difference between, I think, an athlete and a non-athlete is that athletes have a off season.
And we don't.
we don't get, and we don't have an off season. We have an on season. So so it's actually really nice. Like, to work with an athlete in the off season is cool because we can bring on a chef or a nutritionist, right? And we can program, a much more diverse food offering than what they get, in season.
Mm-hmm.
Right? We can make sure they're getting every color of the rainbow every day. We can really max out, these like really high quality sourced organic protein and vegetables. We can really hit them with like nutrient rich food. We also get them on training programs that are a little bit more restorative versus what they're doing in season, unless they need to do something specific, right? Like sometimes the NBA guys need to gain weight to prior to getting back into the season. So then we have to tailor things a little bit specifically to what we're trying to achieve. We use biometric testing on every athlete we work with. So we use an Oura Ring, is my preferred tool for that, for looking at heart rate variability. But certainly we use chest strap, or we'll use a Whoop. They provide good data as well, and to sort of optimize the HRV, we can talk about that in more detail too a little bit later. But we're doing coherence breath work. That's what we're supporting these athletes in learning. One thing I learned from working with the special forces is that they use breath to center themselves when they're in positions of uncertainty, or they need to shift their physiologic state quickly. We can demonstrate those tools to athletes and the general population, and that plays a role in how we can augment our lived experience to optimize in the moment. That's a really powerful tool, and HRV testing and training can help improve that. And in doing so, it also improves like your nighttime heart rate variability and other metrics.
Yeah, you just brought up a couple more questions for me that I'm thinking about. I want to go back to the heart rate variability, but first, so you have all of these metrics, right, that are coming in from, say, Aura or whatever else you're using. You have all of this data, and it makes me think that a lot of times, like, physicians don't actually have access to all of our data. And I just went to a lecture at Scripps Research Institute by Eric Topol yesterday, and he wrote that book, gosh, probably over 10 years ago, The Patient Will See You Now. And I think the premise was, I read it so long ago, but it was like, we have all of this data and we're showing up to the doctor with it, but there's no integration of all of that information. And it's also in silos, right? Like, I know that you work with people's care teams, especially when it's, for athletes, but how do you take all of that data and what do you do with it? How do you organize it?
We get data on everyone, all of our clients. I have a pet peeve about showing up to appointments and a provider not having done their due diligence to meet me with the same level of understanding that I have about where I'm at with them. And everyone's been frustrated with that, right? Like the nurse calls you, they ask you a bunch of questions, you filled out a bunch of paperwork, and the doc shows up and like, hey, what's up, Evelyne? Like, oh, you're here. Awesome. Good to see you. Like, how can I help you? Like, what's up? And you're like, oh, blah, blah, blah. I want to read my labs. Like, okay, well, let's pull them up and see what they say. Like, it's like, no, like that doesn't work. So we have it built into our business model to allow for the time that it takes to get the data that we need from either the client or their doctors, get it synced up, right? If we're using a Whoop, we get synced up to their portal. If it's a Freestyle Libre, we make sure that we're linked up over LibreView. All of that happens before I see somebody, and then I have time to review it before the appointment, alongside any notes that I've had, if they're established or if they're new, our intake paperwork, which is not very long, by the way, but I think it's very focused and extremely effective. I get all of that. Clients love that. Patients love that. If you have to charge an extra $50 or $75 to offer that service, right, so that your staff can collect all that data and you have like a good 10-15 minutes to look at it ahead of time, like it doesn't take, like once you're efficient, it doesn't take that long. As a newer doc, you should give yourself plenty of time, right? Because each client is a huge opportunity for you to learn. However, like, when you get into the rhythm, I've just seen thousands of people, right? You get into this rhythm. And that's probably one thing that maybe sets us apart as a practice is like, I'm never going into an appointment ever. Like, oh, what are we doing today? Like ever. My staff knows to ask, like, have you seen people? Like, give us stuff, like tell us, get this to us. And I know that the two things that working with executives, because it's how they manage their team, right? They want to know, they want to show up. Their time is the most important thing. They want to show up and have you, like, I've literally had clients come to me from some of the people that are doing concierge medicine in the United States, right? The people, like the ones that everyone knows about, and were unhappy because the doctor that they were working with in that practice would just show up and be like, well, what are we doing today? Like, you look pretty healthy. Like, what's up? And it's like, no, we're not paying $40,000, $60,000, $100,000. We're not anywhere near that price, but these are what people are paying for concierge medicine from some of these very high profile individuals. And they're not getting that. And so, like, that's probably the exception that we're seeing, right? We all see the exceptions of each other, and we give grace for that. But it reminds me all the time that our clients' time is precious, right? We should be spending time ahead of time, getting things lined up so that we can come in there and knock it out of the park. We integrate the experience. And then the other thing that we do really well is afterwards, we summarize. Because usually in functional medicine and naturopathic medicine, right, we're doing a wide array of things at once, and they don't have to get done right away. But what has to be done is people need to be kept informed of like where things are at. That's what CEOs get. Like, CEOs get updates, these quick little 5-word updates, right? Whatever it is, right? Supplement unavailable. We're finding a new one for you. Just little things. That's how we manage our clients, and it creates a really strong therapeutic alliance. But there's definitely more texting and messaging going on in our practice now than I've ever done in any other practice before. But it's because we've evolved into a higher touch experience, right?
Yeah, great tips in there. I'm curious, how are you aggregating all of that data? Because it's all coming from different sources. What are you using to look at it holistically?
It depends on the client. We like Heads Up Health.
Okay.
Heads Up Health is great for our CEOs and athletes because we can create a dashboard. They can upload their own stuff if they want. They can play around with it and make it look how they want it to look. They can either pay directly to Heads Up for that service, or they can pay us, and then we have an account. So we like Heads Up Health for like a strong patient dashboard. It works well for us. Interestingly, I have a number of clients now using Function Health, which is a cash pay lab service that provides functional medicine lab testing. And we can then log in together into the client's Function Health dashboard, and we can go through it together. It provides trends. We have clients that use LifeForce. It's another sort of lab testing. They offer provider care too, but it's not as advanced as what we do as functional medicine, naturopathic doctors. It's good. It's really good. LifeForce is good. But it's a little more, what we do is a little more personalized, right?
Yeah.
But they have a great dashboard. And then, nothing's perfect, but it's also not, if you don't want to pay for those kinds of integration tools or deal with them, it's pretty easy these days to pull up 3 different tabs on your screen, right? Maybe it's got their Whoop data, it's got their glucose monitor, and it's got their most recent lab test that you can trend out, right? All the lab companies trend it out for you. And if you're prepared, you can have a very fluid conversation about those things, ticking back and forth between each one with people, right? DEXA scan or whatever, you can just have them up and just tick around. So I know that we've talked about Biocanic. They also, I know, have a dashboard and a platform, EMR integrated. We just don't, we're just embedded in our EMR in terms of scheduling process, just like everybody else. And so to switch is a pretty big deal.
Yeah. Thank you for sharing that resource. So I'm curious, what are some of the top things you look at aside from HRV? What are the top things, no matter who is in front of you, whether it's a CEO or an athlete?
There's probably a lot of the same stuff that everybody does, right? But our general workflow is we run an integrative blood panel that we use Quest because we have a pretty good cash rate. And since we've like kind of just used Quest, they have progressively like continued to lower our cash pricing. Every 3-4 months, they're like, oh yeah, let's go back and ask for a little bit more off, a little bit more off. So, you know, so we run a pretty comprehensive blood panel through Quest. You know, cardio IQ, so advanced cardiometabolics, head to toe. We do, you know, sex hormones, thyroid. We run, right, key nutrients like iron, B12, vitamin D, key inflammatory markers, you know, homocysteine. We run LPPLA2 now, interestingly, more than we did previously, just because there's been some data, you know, on it alongside homocysteine, and CRP is really being a predictor of cardiovascular progression. Yeah, we try to keep it tight. We don't run everything at once, but we do a good blood panel. We try to do that 3 times a year on clients.
Okay.
If we can. Most comply with twice a year, but as any provider knows, right? Trends are so valuable for our clients, and it's honestly something that I think should be in every client's mind as to your value and why it's important to stay with you for a long time. The amount of trends I pick up within physiologic range that then have come to a diagnosis of disease, not functional, whatever, like disease, is a lot. It's a lot. And so, you know, it's so useful to have these regular tools. So if you can get blood work on people 3 times a year, I feel like that's reasonable, and it does yield trends with proper workup, and you'll catch stuff. So we run blood panel on everybody right away. We are running personalized genetic testing. We're using 3x4 right now on everybody, and it's cool. Like, it sets the context a little bit of how to have a conversation about their family history, and does provide some insight. I think that without, you know, current testing, it's tough to really define what genetics mean for an action item for a client. However, I just time and time again, I notice that people connect into their story, they connect into their timeline a lot more intimately with that piece as well. And it, you know, a lot of our clients are searching for explanations, and it does help the conversation. So, definitely. So we run personalized genetics, we run blood panel on everybody. If they're willing, I'll run an adrenal stress index. So either we'll do a Dutch, right? So we get those hormone metabolites, and we get another look at the estrogen and progesterone kind of through the urine. I like blood for testosterone, period, even though it comes up in the Dutch. We could have a conversation about that another time. But then, and the adrenal piece of the Dutch is great. Or we run an adrenal stress index, you know, through Access or ZRT, right? Whatever makes sense from a price standpoint. The data sets are pretty similar, and that's usually sort of where we start with people. That gives us like a good understanding of their health history, hormones, adrenal health, cardiovascular disease risk markers, right? A window into their nutrient status. And it's really like we're not a run everything practice right away. Like, because, you know, like if we're seeing in that basic blood chemistry that their B12 and folate are kind of suboptimal, then maybe we'll reflex to like a micronutrient, but I won't do it before we make the nutritional changes that are obviously impacting those things or implementing a strategy. Now, you know, the exception is sometimes with the athletes, they want a real tight supplement strategy from the beginning. So with the athletes, sometimes we'll move that micronutrient up because it does help us in formulating like an NSF certified stack for them. Or if we're formulating personalized supplements for them, right, that are getting tested and validated, like externally, right? Like they're getting their own stuff, we're doing that for them, then the micronutrients are really useful because we can just dial in exactly the milligram quantities we want of everything and all the deal. So, but that's where we kind of start, and then we'll set forth a series of imaging recommendations for them. Most of our male and female clients, especially if they're in their 40s or above, we're getting a CT coronary angiogram with on them. So not your calcium score, but CT coronary angiogram. We are lucky in San Diego because we have a facility here that is one of the best in the country at the image, right? The AI interpretation is only as good as the image you get. So it's awesome. We use either Clearly or HeartFlow to lay in an AI interpretation. And I mean, I'll tell you right now, the person that pushed me into it was Bronner Honwerger, who, as you know, has been, he was the first physician to take me in under his wing and train me. And I see him as my primary mentor in how I practice. He pulled me aside one day. I was like, Adam, like, you've got to start running these scans on people because a lot of the cardiometabolic, right, risk factors that we are tolerating, right? Like, I mean, you got a totally passable blood work. He's like, I'm finding moderate pathology in these CTCAs, and we're needing to accelerate care and advance and focus really intentionally on the heart. And I've noticed the same thing, right? And I'm confident that we're saving lives running it. So CTCA in my mind is like above any other image. That's like the one. It really is. The other thing we're doing more is full body MRI. The reason I'm moving forward with more full body MRIs is not actually for the tumor screening. It's because now with new groups, like there's a group called CoreViva, CoreViva. They have a center in Newport Beach. But what they are doing is they are giving visceral adipose readings, looking not only in the abdomen, but also in the heart. So they're taking like the viscera, they're evaluating the viscera, and they are providing insight into that. They're also providing insight into the quality of the muscle tissue, and they're providing insight into the joints and like quality of the joints. So arthritic, derangements, otherwise, and a much more detailed brain analysis. So what I'm seeing out of the full body MR is really like a very nice head to toe on like musculoskeletal quality and concerns, visceral adipose readings that are going to be extremely accurate. And then the neuro, right? The head and the brain piece, where we're getting more insight than a neuroquant on its own, right, would give us. So that's probably that was an area that I wasn't really pushing full body MRs that much on my clients. If they had really strong family history, then I wasn't denying them, but I was certainly prioritizing the other testing that we do, right, as functional medicine doctors and naturopaths, and also treatment, like putting that money towards other things. But I'm now moving more towards a full body MR. We also do DEXA. We rely a lot on DEXA scans for our clients to do body comp analysis as well.
Very important.
And then, so that's pretty much what everybody's getting that in our practice, male, female, because they're super useful tools, not just to assess, but like to my previous point, like to test and track, right? Like I want to know that my therapies are making a difference.
Yeah. You brought up so many things there. So I'm going to pause for a second and go back to some notes that I took and go back to a few things. So thank you for sharing about the full body MRI, because I know they can be kind of controversial and sometimes lead to false positives or cause people to worry about things that are benign. And so are you saying the CoreViva that you described, like the other ones like Prenuvo and I forget the name of the other one right now, that they don't do that? Is that what you're saying?
Correct.
Okay, interesting.
Your Simon Med scan, your Prenuvo scan. There's a couple of differences, which is why I'm really excited about the CoreViva. One, the radiologists that review the images are all on-staff physicians. They're employed. They're not contracted. So they are employed. They're available. The radiologist is available free of as part of the cost of the test to review your results with you, with your physician.
Really cool.
It is also categorized as diagnostic testing. This is different to other groups that have this. Well, we're not diagnosing anything with this imaging. We're just giving you kind of like a scan or something. Like these are the quality of the machine they're using is kind of like the next level. And these are diagnostic scans. Like this is diagnostic now, which is important. So you've got, more radiologist involvement. You've got committed radiologists because they're not contracted, they're employed. You've got availability of radiology. You've got an improved machinery, and you're getting these additional insights that you don't typically get on the comprehensive body scan from Prenuvo, for example, right? You don't get the level of visceral adipose scoring. You don't get looking at cardiac fat, right? Because there's fat that can line the heart tissue. It also has a viscera and or muscle quality. You don't get a really detailed dive into your knee joints and the arthritis that potentially could be there. They do spine. You'll get spine with Prenuvo. But yeah, so it's kind of like a little bit more of a, it's looking at a few things that we've always wanted to see for a while.
Yeah.
And it's a little bit, look, it's a little more expensive. I think it's going to be a little more expensive maybe than the Prenuvo, but like I said, you're getting a better screening, you're getting a better machine, and the radiologist involvement, right? Because
yeah,
really
that's great. Yeah, thank you for sharing that resource. And of course, then, for the physicians listening, it's like we have to know what to do with all of that information, right? if you're recommending that test. I'm glad you brought up Clearly as well. We've mentioned it a couple times on the podcast during cardiovascular episodes. I did an event with them here in San Diego a couple years ago and had a physician speak. And I think it's just such an amazing tool. And I think AI in general, right, can be so helpful for aggregating all this data and making sense of it to help us make better clinical decisions, right? It's just kind of like medicine is sort of like lagging behind. Like we have all these tools, but it's just then what do we actually do about it? So thank you for mentioning that. That's CLEERLY. And then you mentioned the imaging facility. Is that Image One?
Image One.
Image One.
Yeah.
Okay.
So yeah, and in addition to Clearly, there's also a scan AI group called HeartFlow.
Okay.
That's also excellent. They look at some different things, and so honestly, in our complex cases, we'll do an image at Image One, and we'll actually run it through both. We'll run it through Clearly to get a really good idea of like the plaque accumulation and characteristics. Clearly is excellent in that arena. And then we'll run it through the HeartFlow to get an understanding of flow rate in these vessels. And having both data sets helps us to make a really strong decision alongside cardiology of how to approach someone's heart health, and then we can track it. But Image One is the group.
And we can get into that more a little bit if we have time to address the cardiovascular piece. I also wanted to go back to HRV that we talked about a while ago. What are some of your top ways to increase HRV? And I'm also curious, because you're looking at so many patterns, do you see a connection or certain patterns in the adrenal stress index related to low HRV?
Absolutely. 100%. the tool that we use most commonly to improve HRV is coherence, breath work, and visualization in and around that. There's a tool by HeartMath called Inner Balance. Put it on your ear. It can help using breath and visualization to strengthen that variability. That, above anything else, has been the mainstay of our work in that arena. Obviously, recovery to activity ratios, sleep hygiene, mineral status, mental health and fortitude, right? These all play a role. Hormone health, the whole thing kind of revolves and shifts HRV, as anyone who's studied it would know. I find that those two strategies, though, the coherence breath work, right, as well as visualization, play the biggest role. Interestingly, maybe not everybody's doing this. We work with both like stabilizing breath strategies with people, but we also do like fire you up breath strategies with people too, like to get people psyched in the zone, right? We want control. We want sympathetic and parasympathetic control. So we train both, which is super fun. And whenever we will see improvements with those strategies on supporting people's sleep and also their ASIs. Yeah, probably like breath work and visualization, targeted supplementation, and then training strategies, exercise programming, and timing are probably the three biggest things that I've seen shift the needle for adrenal indices.
And about how quickly do you notice a difference in the HRV?
Oh, 6 weeks.
Okay.
Easy.
That's great.
Yeah, quick. Mm-hmm. Like when we have a guy in the off season, for example, or a woman in off season, we'll see significant changes in their heart rate variability within that window.
That's great. You also mentioned supplements on there or in that conversation. So I'm curious, like, what are some of your favorites in this area?
Yeah, I mean, adaptogens are where we shine in herbal medicine and naturopathic medicine. I think, these are some of our most impactful tools that we see big shifts for folks, safe and effective. So, that could be ashwagandha, that could be rhodiola. We use ginseng in male clients particularly, but also female clients. Those are some really lovely herbs. Holy basil, right? For a long time, right? Especially used with providers. Providers seem to connect in with holy basil. Passion flower. So yeah, I think the adaptogens are a great tool here. I also really enjoy using mineral formulations and electrolyte formulations for clients, just given the food and water quality concerns that we're all navigating.
Right.
We see in we do hair tissue mineral analysis. And I find hair tissue mineral analysis a really useful tool to help adjust and correct mineral imbalances.
Yeah, I think that's an often overlooked part of it, right?
Yeah, you mean the minerals specifically? Do you see that when you talk to, or like when you see what providers are doing?
Well, sometimes I just forget because it's so basic, right? And we know that they have like the inverse connection with metals, and we know that people are deficient. And obviously we have to figure out like, why are people deficient, right? Is it just a diet thing? Is there a gut issue? But I started taking minerals myself recently because I was deficient in some of them, and I was sort of surprised or a lot surprised. So I think it's just like a foundational thing that we forget about.
Mm-hmm. And it's kind of easy to integrate into your program, right? Like It's not
Absolutely.
like a big lift.
Right.
Yeah. It's not a heavy lift. And most people that we start working with mineral, it's almost like, it's like putting salt on food. Like you add minerals to your protocol and everything works better.
I love that. That's so
It's like,
true. Right.
it really is. Like, don't you reckon? Like you probably
Yes.
didn't shift too much of your other program. You just topped these minerals in and you're
Right.
like, oh, right. Like I'm just
Yeah.
grooving a little more.
Yeah.
Yeah.
I want to talk about a few more things, and I can't believe we're almost out of time. But something that you mentioned to me when you and I were chatting is like men in their 40s and 50s, they often represent like these lost decades where they're relatively healthy on the surface, but then, underneath, like things are brewing, right? Because we know a lot of these neurodegenerative conditions, cardiovascular disease, all these things are brewing, right, for decades prior. Talk a little bit more about that.
Men's health is, in general, what's interesting is like in my career, more and more I'm getting clients who are searching for someone who focuses in men's health. It's very interesting that that is an expert in men's health. And I love the trend because yes, the 40s and the 50s for men is typically they're lost decades to their own health, well-being, and longevity. Typically we're working, we've got young kids, we have families, we have parents that we are supporting, and it's like it's a whole thing. And what it results in is inconsistent doctor visits, if at best a treading water approach to nutrition, supplementation, training, and lifestyle. And these are the windows. Like these are the decades where we can really be laying the foundation for muscle mass, joint health, cognitive function, and bolstering these guys to the point where when they hit their 60s, we can maintain. And when we hit the 70s or early 80s, right, when it becomes really hard to keep muscle mass on and the things we want in place humming, right, we have a really robust reservoir. Starting in the late 50s or early 60s is totally doable. But I just feel like, and it doesn't take a ton of time. I just feel like if guys would be willing to get in to the clinic and hop on these protocols before they start feeling really, really bad,
Right.
it would just make a huge difference. And, I'm starting to see it. I'm starting to see that change, but I hope that we get these, to all the other doctors that listen to this podcast, please start doing PSAs on public service announcements, not the blood test, but the blood test is important too. But tell your female clients, or tell your social media community that dude, got to get guys in, even though well, there's nothing wrong. Every time I see somebody, they are always well, my wife sent me, well, what's going on? Nothing. Okay, well, how's this? How's that? How's this? How's that? It could be better. Could be better, doc. Oh, tell me a time when you were working with a coach and you felt your best or whatever. What happened to that? Well, I think I'm doing okay. It's well, do you want to be okay or do you want to be great? And so, the answer to that's always, I want to be great. Because they're great at other things, right? They're great with their family. They're great with their kids. They're great looking after their folks. They're great in business. And they're just whatever with their health. And that's just inconsistent. It's a pattern. And I think that it's a key thing to shifting not only men's quality of life as we age, but also this thing that's happening in younger men where men are going through an identity crisis, period. particularly younger men, are going through these identity crises where it's like, who am I right now? Like, there's a shift in the, roles and responsibilities in our society, which is phenomenal and amazing. And men are looking now for their intention, their purpose. And I'm confident that if these adults, these dads, are setting an example of proactive work on their health and wellness, that's going to lead to more engaging experiences with their children, right? Doing adventures that just that alone, that will then translate to a shift in what we're seeing in this young male population.
Yeah, excellent point. I want to talk about testosterone a little bit because, we hear about, testosterone is going down in all men. I know a lot of men come to you specifically like, doctor, give me testosterone. But I'm curious, what are some of the underlying reasons? But then also, what are you doing to address this? And I'm kind of curious, aside from, or maybe even before TRT, are there other things that you're doing or doing concurrently with that? Because in my opinion, it's not without some level of risk, doing that. So I'm curious what your thoughts are on that.
We'll talk about kind of like the general male, like maybe the exec, right? Because when we work with the special forces guys or the firefighter, right, they have obviously unique histories and exposures that are extenuating circumstances. So they're addressed in a different way. But usually there are significant nutrition and lifestyle adjustments that can be put in place to understand. I kind of talk to the guys about it like this. I go, look, because typically they'll have a number. They'll come to you with a number. They're like, dude, my testosterone's this, and I'm feeling these things, so I'm convinced it's this, right? And you're like, look, it's probably part of it. I'm like, but we don't know what your true physiologic potential is because we've got all this static in and around the test. We've got poor eating habits. We've got undertraining or overtraining or improperly training. We've got, suboptimal sleep. We've got, low HRV and irregular stress management. We've got challenges with your relationships. Right? We need to first acknowledge that these things are contributing to that number. And whatever we do, we're going to be working on optimizing those things. And the way that we do that, right, Evelyne, is we use herbal medicine, we use specialists, right, coaches, nutritionists, we use mind body therapists, whatever we need to do to really start to play this out. Red light therapies, other types of modalities, so that no matter where we go with the testosterone, we're really optimizing this sort of foundations of health piece as we move. It's not only going to give us an idea of what their real physiologic potential is, it's also going to allow for the appropriate elimination of anything we do, keeping them safer. And we're going to get a really clear understanding of other potential comorbidities, right, through testing. Hypothyroidism in men is a thing. And so you should always screen for it. And there's some other pieces that can be sort of directly impacting why they're feeling like they think they feel because of their testosterone. So that's sort of where we start, and our integrative panel will rule out significant pathology that would be one, give us an understanding of how we can treat them, right? If there's primary versus secondary and the whole deal. And also sort of help us understand kind of the other factors that are at play there, alongside the adrenal stress index and a good nutrition and lifestyle journal. If we have sleep data, right, we kind of have everything we need, right? If they're because it's like, look, give a guy as much hormone as you want, but if they're apneic, you're not going to get where you need to get with them. I've caught anemic guys, I've caught hypothyroid guys, and you fix that stuff, and they're like, whoa, I feel great. And their numbers go up, and it's like, oh, cool. Good thing you didn't just go to the clinic, across the street and just get a shot, right? So we've got to look at all those pieces. We have to put in play minerals, electrolytes, protein, creatine, right? Hydration. These are foundations, right? We've got to make sure that their nutrients are supported and nourished, right, through food and supplementation. Have to. There are herbs that we can use to support the way men feel. We talked about some of the adaptogens before, but ashwagandha is a great tool. Maca, strong, ginseng. Those are probably the three that I see that really move the needle. There are others, that Tonga Ali and Tribulus, and there are other herbs that can be helpful. Minerals like boron can be supportive of the testosterone to free testosterone relationship. They certainly, are not harmful. However, I really like I think that focusing on maybe just a couple of herbal interventions alongside sort of the core mineral, electrolyte, protein sort of dynamic, making sure they're getting enough healthy fat. Those are great places to start with every guy. Now, you're going to have a test that comes back, and you're most likely going to have everything you need when you see them the first time if you wanted to get going on something higher level, right? Because you're going to have your hematocrit and hemoglobin, you're going to have probably a PSA, you'll probably have a total and free testosterone, you have a sex hormone binding globulin, right? Maybe you'll have a DHEA as well, which can be helpful. But you're going to have kind of everything you need. And, I think that the world of men's health, there's conversations about how to actively target a man's testosterone levels. Certainly, the majority of the literature lies in using testosterone itself in different dosing frequencies and strengths. However, there is a robust set of literature for using endogenous agonists to support a man's testosterone production itself. Most commonly, right, clomiphene, HCG are used. Gonadorelin is also used. There is definitely in the people that come and see me, they have a desire to try to maintain their own production for as long as possible.
Yeah. What's the range that you like to see? I'm sure it depends on different ages, but
I'm a big proponent of kind of the Venn diagram of decision making, in that we have labs and we have patient perceived symptom picture and improvement, right? I really do lean on both very equally when I work with men. I think it's important to do so. That being said, I definitely want guys' numbers to be above, a total of 650. Definitely. And if their free testosterone can be in the upper quartile of normal or higher, that's great. Where I historically see men really are whoa, doc, I'm on right now. This is awesome. Usually they're in the 800s or above. Usually they're somewhere between 800 and 1,000. That's usually where they're starting to feel like the lights are turned on. They're not experiencing, hair loss or acne, significant testicular shrinkage, or some of the other things that can happen. We can get there with foundations of health and supplementation for sure. We can get there in cases with HCG or clomiphene on its own. We can get there with cases of that HCG or clomiphene alongside testosterone, right? And we can get there with testosterone on its own. I think the most, we've seen an evolution in how we do this over time. Since I started practice in 2016, we were doing things differently than we are now. So to me, that's very reassuring, because we are all communicating with each other, and there's data points being created on this particular topic. So, I feel confident that when I start a guy on a protocol, that I'm kind of doing minimal effective dose, tracking lab work and perceived improvement, every, 8 to 10 weeks, 12 weeks in the beginning, and then, ideally 16 weeks thereafter. And that, that keeps guys safe. I think one thing I do with every man, I don't know if everybody does it, but I make sure that they go and give blood. They go and donate blood, regardless of what strategy they're on. If they can donate blood 3 times a year, not only is it good for humanity, and it also helps and keeps their, hematocrit and hemoglobin dialed in. Not everybody's levels, shoot up like that, so it's necessary. But I've kind of just, because like you mentioned before, I was in such a high volume clinic, I was seeing lots, and I just kind of made it like a blanket. Like, all right, if you want to work with me, the blood bank's going to be your buddy. And this is what we're doing. This is your, like we call it, a mitzvah, right? This is your mitzvah. You go, you give blood. It's good for you. It's good for the community, do it. So was that kind of helpful in terms of thinking about it?
Yeah. You shared so many amazing clinical pearls. And I feel like, throughout this conversation, you've shared such great information and such thorough information. And we could have gone into so many different directions, and we do have to wrap up. Unfortunately, we didn't even get to talk about like mental health in men, which is, such an important piece too. But I want to wrap up with some rapid fire questions. So my first one is, what are your 3 favorite supplements for yourself?
Yeah, the supplements that I'm using consistently now, right, are minerals. I take a mineral blend. I take electrolytes. And honestly, like creatine monohydrate has been in my stack for a decade or longer.
Awesome.
And I don't know. I love it.
Yeah. Great. What are your favorite health practices that keep you resilient and balanced?
I've just been really lifestyle focused now, even with my own clinical practice. So focus time with my kids twice a day, right, is like kind of a non-negotiable for me. Connection with Serena, my wife, on a daily basis, where we can just take a moment, even if it's a hug or a short walk. We live right near the beach. And so that like connection to the people in my life that I love really feels good to me, because the rest of the day I'm having connection with other people.
Right.
So I make sure that I give that to them. I love the breath work that I'm doing, right? Like I really think that the breathing strategies just help put me breathing and visualization. I don't know if everybody does this, but when I do our regen procedures, when I start working on someone, like when I'm about to inject into a joint or something, I like mentally go to a place of like, this is very hippy dippy, but like I go to a place of like love and compassion in my heart. Sometimes I think about like when I used to play music with my dad, and I go to that feeling, or like, and then I inject. Like, I don't know. I think that there's something there that helps us stay centered and intentional. So I've been trying to do those things. Interesting. Lisa Portera Perry, if you have had her on the show, or I'm sure people know Dr. Perry, she's a legend, but she used to talk about every time touching a door handle, every time you touch a door handle, right? Because usually you're then exiting or entering with a client, right? To take that moment to do the breath and center yourself. So like, it's an interesting little strategy that could be brought into everyday life. Because if you think about it, like anytime you're opening a door to go someplace, it's an opportunity to be present for that specific thing. So using the breath work is something that I like to do. Connecting with my family is important. And then, like I told you, the third thing is playing music. I've been getting into, playing with the band. We got band practice tonight, and I'm frothing. I'm so stoked. So doing those things have been really supportive for me. I'm pretty active. So training is something that I just have on point.
That's great. And last question, we'll try to keep this one brief. What is something you've changed your mind about through your years in the field, which could also be not a brief answer?
This is like real talk, is the use of appropriate pharmaceutical intervention in cardiovascular disease prevention for high-risk patients.
Can you expand on that just a little bit more?
I see that we now have a variety of therapeutic interventions that are pharmaceutical, from more specific blood pressure medications all the way through, right, to really advanced cardiac modifiers. It's not just the statin world anymore whatsoever.
Yeah.
And running more cardiac imaging, having followed patients for longer in my career, I've become more comfortable with the blending of our foundations of health, our supplements in herbal medicine, and the use of targeted multimodal drug therapy in curbing the inevitable in a number of these clients, which is premature death from cardiovascular disease. These strategies are not just for the individuals that are not compliant with all the other stuff. It's not like, oh, well, I guess I couldn't get you to do this because of all these things, and now we're going to give you these drugs. Like, that's not, I would encourage people to, especially, those that are, I'm always reticent of any drug intervention, right? I would just encourage people to continue to look at it and assess it.
So it's not an either or, it's a both and.
Right.
Yeah.
Yeah, exactly. And there is, working with a preventative cardiologist has helped me significantly in balancing that with the other things that we do for these people, right? The bioidentical hormone replacement and all the other beautiful techniques that we have. But,
great.
That blend of the CT coronary angiogram, those tools, and then using, these higher level interventions earlier is something that I've been doing more in my practice. And that's, like, you can hear it in my voice. I'm just like, oh my gosh, am I going to get, put on the flame here? Right?
No.
That's
no, I appreciate you sharing that.
That's probably the thing that has changed the most from when I started practice to where I am now.
Thank you so much for sharing that. And Adam, thank you so much for being here today, for sharing so generously with me, with our audience. I really appreciate you.
I appreciate you, Evelyne. Any opportunity I can to support you, because, you're awesome. And our community is a blessing. So I appreciate the time.
And thank you for tuning into Conversations for Health today. Check out the show notes for resources from today's episode. Please share this podcast with your colleagues, follow, rate, or leave a review wherever you listen or watch. And thank you for designing a well world with us.
This is Conversations for Health with Evelyne Lambrecht, dedicated to engaging discussions with industry experts, exploring evidence-based cutting-edge research and practical tips.